If you're here to learn how to use the calendar method for contraception, I'll advise you to get a notebook and watch this video to the very end because I'm going to be dropping all the information you need to know about it. Hello everyone, welcome back to my YouTube channel. My name is Nurse Busari and I'm a Nigerian-based nurse. If you're here for the first time, there's a place on your screen that says subscribe. Kindly click on that place to join the YouTube family and also on the bell icon so you get a notification whenever I drop an eye-opening video like the one you're about to watch now. So without further ado, I'm going to get right into the topic for today. Today we're going to be learning about the calendar method for contraception. It is also known as calculating safe period. It is a very safe means of contraception because it doesn't involve the use of drugs, injections, surgery, or any other thing that other family planning methods consist of, and it has been in use for a very long time. I won't be surprised if a lot of you here know about the calendar method for contraception, but what a lot of you may not know about is how it works and why it may fail. And I'm going to be talking about everything related to calendar method in this video today. But before that, you cannot properly understand the calendar method if you don't understand what is called the menstrual cycle. So first, I'm going to be talking about the menstrual cycle. So about the menstrual cycle, it is actually a physiological process that occurs in every woman from puberty till menopause. Now, I won't be using so many medical terms because I want everybody to understand. So what I just said earlier is that it is a normal process and it occurs in every woman once you attain puberty and till the end of puberty, which is menopause, when you stop menstruating. You get my point? So basically, the average number of days that menstrual cycle takes is 28 days. Average. Some ladies may have theirs lesser than 28 days or more than 28 days due to individual differences. So before you can even think of using the calendar method, you have to understand your personal menstrual cycle. And how do you calculate that? You calculate from the first day of your period till the first day of your next period. The number of days there is the number of days involved in your cycle. You have to at least count for about a month or two if possible to be sure your cycle is stable, because if your menstrual cycle is not stable, then it is impossible for you to use the calendar method. So the menstrual cycle contains about 3 stages. The first stage being the menstrual phase, the second one being the proliferative phase, and the third one being the secretory phase. I'm going to be explaining these phases briefly so that we all understand them and we're able to identify them and also be able to use them in calculating our safe period. So the first phase being the menstrual phase is the start of your menstrual flow, like your period, your monthly flow of blood, if you get what I mean. Every lady has that. So for some ladies it may take 2 to 3 days, some it may be about 1 to 5 days, but mostly it shouldn't take more than 7 days. That is the normal time. It shouldn't take more than 7 days. So I'm going to be taking an example of Lady X with menstrual cycle that lasts for 28 days to explain the use of calendar method so that we all can understand. So the first phase, which is the menstrual phase, lasts for about 2 to 5 days and in some cases 7 days. But for this video, I'm going to be using a menstrual phase that lasts for 5 days. In other words, Lady X starts a period on day 1 and stops on day 5. That is the menstrual phase. What happens in the menstrual phase is that the endometrium, which is the medical word for the innermost part of your uterus, by that I mean the womb, is shed off with the ovary that wasn't fertilized previously and it flows out as blood. That is what you see and that is what you call menstruation. I'm sorry if you don't really like to hear the word, but I don't see any big deal in talking about it. So, like I said, it could last for about 2 to 5 days. So, if Lady X menstruates for 5 days, it means from 28 days we have removed 5 days and we have 23 days left. Now, the second phase lasts from about day 6 of the menstrual cycle to day 14. This phase is when your uterus or your womb is trying to repair the part that was shed off. Now, this is where the safe period falls. But there is a little calculation that you still need to do within this safe period, which most people forget, and that is why they assume that the calendar method doesn't work. I'm going to be talking about this in this video, but later on. So the third phase, which is the secretory phase, is what lasts from day 14 till day 28, and this secretive phase coincides with ovulation. So that is when you have the highest chances of getting pregnant. I hope you get my point. So we have three phases: the menstrual phase, which is where you're menstruating; the proliferative phase, which is when your womb is trying to repair itself and it's safe to have unprotected sexual intercourse with very little chance of getting pregnant; and you have the third phase, which is the secretory phase, that also coincides with ovulation, and you have the highest chance of getting pregnant. So you have day 1 to 5, 6 to 14, and 15 to 28. Now that we have all understood the menstrual cycle, now we can talk about the safe period. Like I said earlier, the safe period falls within the second phase of the menstrual cycle, which is the proliferative phase. Since the proliferative phase in an average menstrual cycle of 28 days lasts from day 6 till day 14, meaning that you have 8 days safe. 6, 7, 8, 9, 10, 11, 12, 14. You have 8 days safe. But the issue here is that not all those 8 days are entirely safe. The last 3 days of those 8 days are actually not safe. Do you want to know why? Now, this is it. The male sex gamete has the ability. Now, the male sex gamete has the ability to remain viable in the female reproductive system for 3 days. An average of 3 days, I'd say, because there are many textbooks and different authors and different scientists with different ideas about the actual number of days that the male sex gametes can remain viable in the female reproductive tract, but it is an average of 3 days. Is the little calculation that I was talking about earlier, that people that use this for family planning or for contraception forget to do and feel that this natural method does not work. Like I said, this method is actually very safe if you want to space your children, or a couple that you're not ready to get pregnant yet. This is very safe for you to use. You don't need any drug, any injection, any surgery. You don't need to go to the hospital. You just need to understand your normal menstrual cycle, and this is actually very effective. If you want me to talk about other methods of contraception that are natural, kindly drop that in the comment box. If you have anything that you didn't understand from what I discussed today, you can also drop that in the comment box. Thank you for watching. Don't forget to subscribe and share to your friends. Bye bye. See you in the next video.